The Federal Centers for Disease Control and Prevention have identified 4 groups that should be prioritized when we have a vaccine, but we don't have enough for everybody. So the first group is people who are engaged in responding to the pandemic, in particular healthcare professionals. Second, we need to protect those who maintain our national security and essential community services like firefighters and police officers. Third, children and pregnant women would receive priority. And fourth, workers who are engaged in jobs that inherently expose them to more risk of infection and illness. These groups have to do with our response to the pandemic, to finally quashing the virus, and also out of a sense of moral obligation to people who are particularly vulnerable and who represent the future of our society.